Okay, we'll go ahead and get started. If you have any questions at all throughout the presentation, since you don't have a microphone, if you want to just put those in the chat, I do have the chat pulled up so that I will see it when that question comes through and I can answer it then. We like this to try to be a conversation, which is a little hard to do if you're using chat, but we'll do the best that we can with this. I want to welcome you to the Big Sky Care Connect Health Information Exchange End User Training. This training is designed to help you get started with the HIE. This project is funded in whole or in part under our contract with the Montana Department of Public Health and Human Services. The statements herein do not necessarily reflect the opinion of the department. I will let you know that no real patient information is being used in this presentation. I am recording, so when I do get into the system to show you around in there, I will be using a test patient with all pretend information so that we don't accidentally expose any real patient information there. My name is Kelly McDermott. I am the training lead for Big Sky Care Connect. I do have a background in training, education, and professional writing. So when I put all that together, I really am in my happy place. I have worked on this type of training for North Dakota's Health Information Network, which is their statewide HIE, and in South Carolina and in Kentucky. I am from Kentucky and was really happy that I could work on the training for that system. If you have any questions, please let me know in the chat. This recording that I am doing for this training, I will send you a link to that probably in the morning because it takes a couple of hours to download to my computer, but I will send that to you in an email as a follow-up, and that is yours to do whatever you need to with. If you need to use it as a refresher training, or if you need to train someone else on it or show it to someone else, however you want to use it, it is yours to use. I see that we do have Vicki and Stacy trying to work on volume there, but that's fine. Just let me know if you do get it going and can say something, then just let me know that way. Like I said, this training is designed to help you get started with HIE. Hopefully going to give you enough information so that your experience is the most efficient and effective for you. This presentation is really geared towards the data and functions that you will have access to right now if you were to get into the system today. I did send you a link to some training materials. There are some quick guides there that are really helpful for logging in and accessing patients and the clinical icons that you may see that are in the HIE. But also the user manual is there, and the user manual does have all features and functions and information to come for the HIE. Some of it we're not going to be showing today. Vicki, I think, yep, I think I can hear you now. Want to say something else?
Can you hear us?
Oh, yep, I can.
Okay, we'll go ahead and mute so we're not talking.
Great, thank you. Yeah, if you have any questions, just interrupt me. Just come off mute and interrupt me. I tend to talk fast sometimes, but again, we want this to be the best for you. And if you have a specific question, let me know and I will tackle that. That link that I did send in the email is to our website, and that is where we have those training materials. We also have some training videos there if you need to use those as a refresher. Whenever new functions or features are implemented on the HIE, that is where we're going to put new training videos. And that way you don't have to schedule another appointment or another training with me. Not that I mind, because I always love doing trainings, but we thought that that would be the easiest, most convenient way for you to get new information on the HIE is to be able to just go to the website and watch a short training video. But again, you can always contact me if you need anything specific. We are here to help. We create process flows for organizations. I can create any type of training material that you need. If you need me to just do a specific one-on-one training with you or a group, I can do that. Again, we want you to be able to use this in the best way for you so that you will use it, because that's the only way that it's really going to bring value to Montana. You can see that the help desk information is there at the bottom of that slide. That is their email and their phone number. They are available 24/7. So if you can't get a hold of me and you need something, they are there all night long if you're on a night shift. If you need help finding something in the system, if you have a question, if there's just an issue going on, please contact them and they'll be able to help you with that. I will show you this information again at the end of the presentation just so that you have it fresh in your mind. So today what we're going to talk about is getting started with the HIE, how to use the search and viewer, because that's really how we find patients in the HIE. We'll talk a little bit about patient consent. SCL is not allowing their users of the system to override patient consent. We do have it in there, and I'm going to show you where it is. But if you try to access it, then you're going to get a stop sign. Now, I think that they are allowing their emergency department staff to use that. If you are part of the emergency department staff, if you know that you're going to have the ability to override sensitive data, then I do have a video on the website on that, on how to do it and what information you'll have access to. But SCL doesn't want just their regular users to be able to do that. So we're not really going to talk a lot about that today. We're going to talk about the options that are available on your menu and user profile. We'll do some just simple high-level troubleshooting information and then come back to this contact information here. Are there any questions for me before we get started? Okay. This slide right here is showing you the organizations that are live in the HIE right now. And when I say live, these are the organizations that are actually contributing data to the HIE. We have several organizations that have signed up to be view only, which is where they're going to get into the HIE just to get the information that they need, but they're not necessarily contributing information to the system. These organizations are contributing information to the system. And it may be different for each organization. Some of these organizations are contributing multiple amounts of data, and some are just contributing 1 or 2 points of data. And some of these organizations are wanting to contribute all of their data. It just takes time to get all of those points connected within the system. So the information that you're going to see when you get into the system is a little bit limited right now, but as more and more organizations go live and make those data connections, then that information is going to continue to grow. Other than these organizations that you see on the screen right now, we have over 50 organizations that are in various stages of going live to the HIE. So as you can imagine, when all those organizations are live in the HIE, that's going to be an enormous amount of data that's coming in for the community, for the patients in Montana, and for you guys as healthcare workers to help you get the most out of that system and get the most information on your patients as you can get. Right now, the data that you can see that's in the system that these organizations that I showed you were contributing are patient encounters, diagnoses, allergies, medication, lab results, diagnostic studies, problems, and patient demographics. Now, there are some things to come, such as immunizations, vital signs, histories, and clinical documents. Those things are coming. They're not there yet, but as though it's either that function hasn't been implemented yet in the HIE, or we don't have an organization that's contributing that data yet, or it just hasn't gone through testing yet. So there are various stages, again, for those data points there too. As those features are implemented, I will release another training video on the website. If you have any questions about it, hopefully it'll answer those for you. But we will review each of these that you see here on the slide today in the system so you know what to expect when you are in there. The HIE is role-based, so the type of access that you have in the HIE is based on your role. And this is determined when you sign your AUA form and get it turned into your administrator, who turns it into Big Sky Care Connect. And there are various roles. We're only going to talk about the top 2, the most common 2. And within those roles, there are some other options also, such as being able to access sensitive data. And there's other options within there too, but we're just going to talk about them at a high level so you know what to expect when you get in there. Clinician users, these are the users that are at the point of care with patients. So usually doctors, nurses, assistants, pharmacists, radiologists, anyone who is at that point of care with patients is usually in the clinician role. As a clinician, you can search for patients by having a limited amount of information on the patient. You can view all patient records for patients that you are trying to access. You can find all patients that are not opted out of the health information exchange. You can view the patient summary document. You can, if you're in the emergency department with SEL, you can override patient consent in emergency situations to view patients who have opted out of the exchange. And you have access to medication data for the patient. Again, there are some options within that role also. Clinician clerks, these are users that are usually front office staff, coders, billers, some administrative staff have this role, and they can only access patients that they have information for. They can't do a cold search on a patient and be able to find information. They can search for patients by demographics. They can view the patient summary document. They cannot, in any case, override patient consent to view patients who have opted out of the exchange or view sensitive data. Logging into the HIE is very easy. These are the browsers that support the HIE, anything and everything as far as browsers go. If you notice, there are some mobile device browsers there. I cannot, in any circumstance, advise you to access protected health information on your mobile phone. But we do have some organizations that use tablets, and these browsers are just fine for that. Obviously, I want you to follow your organization's policies around when it is okay to access protected health information. But as you can see, it's pretty much anything and everything as far as browsers go. When you do access the HIE, if you go ahead and bookmark it on your browser, it makes it easier to access it the next time. When your organization participates with Big Sky Care Connect, the help desk will create your account for you. Once that account is created, you're going to receive 2 emails from the help desk at the email that you provide on that AUA form. The first email is going to have the URL to the HIE, which will bring you to this page here. Again, it's easier if you bookmark that so you can access it in the future. And it's going to have your username. The second email is going to have your temporary password. A temporary password is good for 60 days until you use it, but you have 60 days to use it. You'll be prompted to change that password as soon as you log in for the first time. If you can't use that temporary password within the first 60 days, it's not a problem. Just reach out to the help desk and they'll reissue you a new temporary password. If you signed up to have access to the test patient, then you will get a whole separate email about that with a new username, because you have to log in separately in order to access that patient. So you can play around with that test patient and not mess up any real patient data there. If you did sign up for that, there is a quick guide on how to access those test patients on the website at that link that I sent you. So make sure that you look over that, because that will really help you out with how to access that. So here you're going to put in that username that was in your email along with that temporary password, and you're going to hit login. Again, it's going to prompt you to change that password to your password. And the password requirements will be written, they will be on the screen, so you don't have to memorize these or write them down at all. And they're pretty standard as far as password requirements go, except for that 12 characters. It's really hard to get 12 characters sometimes with a password, but as long as you get to that 12 characters and meet 3 of the other standards there, then you're good to go. So you're going to put in your username, the old password, that's that temporary password that you just used. I don't like the name of that field because it can be confusing sometimes. You're going to make your new password, confirm that password, hit submit, and that's going to log you into the HIE. This is the first screen that you get to when you enter the HIE. This is the search and viewer. So what I'm going to do is go ahead and get logged in here. Now I will point out before I log in, this is something new that we just started. You can see right here that we have some announcements. So Dahl Memorial just went live with demographic data. So they are sending demographic data right now into the HIE. And Logan Health is now live with radiology reports. So you can start viewing those in the HIE now also. So we are going to start putting announcements here for new things that have happened with the HIE, which I'm excited about because that was something that we've been pushing for a while here. You can see the legal information here, but let me get logged in so you can actually see the system. Sorry, I have a hard time typing and talking at the same time. There we go. So you should be able to see my search and viewer screen here. There's a couple of things to point out. You can tell that there's different sections that you can use to search for a patient here. You have the search by medical record number section. This section, you are required to fill out both fields. A lot of times we don't have this information. So a lot of times this isn't the section that we would use to search for a patient. But if you're a coder biller, front office, if it's an established patient, most of the time you do have this information. If you're just checking on an encounter or a specific diagnosis, then this will be the easiest section to use if you do have that information, because it will find that exact patient in the system. And if it doesn't, it's going to tell you no match is found, and you just have to come back and either fix a mistake or search for the patient in a different way. So that clinician clerk role that I was talking about, they would have to have the facility and the medical record number associated with that patient at that facility in order to be able to find the patient that they are looking for to code the information that they need or to verify any information that they need. I point out this section because it is helpful in the future, because after you get into this system and see this patient, you will have this information. So if that's how you want to search for the patient the next time, you can use that information. You'll see that there is a magnifying glass here that signifies that there is a relevant drop-down list for that field. So for facilities, it's simply the facilities list. So you can scroll through it to pick the facility that you want, but these fields are very intuitive. So I can start typing in the facility that I want, and it's going to give me relevant options below it, which is probably going to be faster than me searching through that list 5 at a time to try to find the facility that I want. Again, in this section, you have to have both fields completed. If you try to search without that, it's going to give you this error up here, and you're going to have to start over there. Search by demographics. This is usually the section that you're going to use to search for patients. In this section, you are required to have at least 3 characters of the last name plus 3 characters of the first name. Or you can have just 1 character of the last name and the full date of birth to do a search. That's the minimum criteria. Now, I will tell you there are plenty of fields here, and the more you complete in this section, then the more refined those search results are going to be. If you use just that minimum criteria to search for a patient, the HIE can pull in up to 50 search results for you to look through to find that patient. Now, that's good because if you have a spelling error in there, or if you don't know exactly how to spell the patient's name, but you can get it in there phonetically correct, then it's going to pull up that patient for you. You may have to look through the list some, but it's going to pull up that patient. It's not good if you know that criteria that you want to use, or you just know those 3 characters of the last name and the 3 characters of the first name, because it could be more work for you to find that search result there. But it's designed that way for a reason, because there are a lot of times that we don't have all the information that we need. My recommendation, if you are searching by demographics, which most likely you will, if you have the information, put in the full last name, the full first name, and the full date of birth. And what that is going to do is refine those search results for you. If I put in that information in production right now, it's going to pull in maybe 7, 10 at the most search results for me to look through to find my patient, which is a lot more manageable than the 50. And Courtney, I see that you've asked how long those announcements stay posted. That is a great question, and I don't know the answer to that one because they just started it right before I got onto the session to teach today. But I will get you that answer, and I will put it in that follow-up email that I send with the link to the training, and because I'm curious about how long they're going to stay there also, because I'm sure I'm going to get that again. And stuff, but I'm just excited that they started doing it, because again, we've been pushing for that for a long time there. So here in the demographics, it also allows you to tab through this section, which helps if you're a typer and you don't like to use your mouse and have to click in the fields. So it lets you go a little bit faster here. So I'm going to put in my patient's full last name, tab, full first name, tab, 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 and I'm going to do the date of birth, because again, I want to just pull up a refined search result so I can find my patient quickly and get the information that I need. Well, here for the date of birth, I have a couple of different options. Now, if you are a mouse person and you like to use your mouse, you can use this widget right here by clicking the calendar. It's going to automatically default to today's date, which never helps you for a birthday. Hit the month and the year at the top. Do not select the month first, select the birth year first. So I'm going to select the year again. Then I'm going to go through, find the year that I need. Then I'm going to select the month, then the day. I think that's a lot of steps there. So what you could do, if you like to type and tab through the sections here, you could just use the 2 numbers of the month, 2 numbers of the day, 2 numbers of the year, and hit enter. And it's going to default to the correct format for you. Now, that only works if the birth year is in the 1900s. If the birth year is in the 2000s, then simply use all 4 numbers of the birth year and it will convert that way. So that helps you get through that section a little bit faster and you're not spending so much time having to click in places and click all those different sections of that widget there. So I have more than met the minimum criteria to search for a patient at this point. But let me point out that there is another way to refine your search results just a little bit more. It's this section right here. Now, we do not have cohorts or relationships yet. Those are coming. Cohorts are going to be associated with your username, and you can set up different lists of patients in whatever way makes sense to you. If you have patients that you see most often and you want to set up a cohort of them, or patients that have a specific condition that you want to make a cohort of, or patients that are on a specific medication or a certain medication that you want to keep track of. That's up to you how you want to do your cohorts there. And again, when that feature is implemented, I will release a training video on it to help guide you through how to set those up. Relationships, you can actually search eventually, not activated yet, you can eventually search for a patient by their care team relationship. So by their primary care physician or their pharmacist or their oncologist or their radiologist. Those will be set up eventually for the patients and you can search for patients by that. But this restrict facility is active right here. Now, what I have in here right now is telling the HIE to use this information to search the entire database for anything that may match this information. And believe me, it will pull in things that you're like, how did it even get to that? I don't understand. Which is why I recommend that you refine it a little bit there. What I can do here is instead of telling the HIE to search the entire database for this information, I know that David has been at this one facility and I know that he has information from this facility. So I only want the HIE to look for information up here that may match only from this facility. Now, it's not just going to pull in that record for David. It's still going to pull in all the information in the HIE on David. It's just as far as searching for this information that I put in up here, it's only going to return any matching information that is associated with this facility for me to have to look through as a search result. Are there any questions over that? So again, I'm just telling the HIE to look for this information associated with this facility, and I can go ahead and search. Before we search, let me talk about this override consent policy. Big Sky Care Connect does follow an opt-out model for our patients. If a patient wants to opt out of participation from the HIE, there's a form on our website that we send them to. They can complete that. It gets turned into the help desk. The help desk will put in that information, and users are blocked from seeing those patients. Now, some of the users, some of the clinician users for SCL that are in the emergency department does have a capability to override that consent in an emergency situation. And this is where they would do it. There's a separate training for that. This is also where if you had that ability to override sensitive data, which again, you have to be in the emergency department for, this is where you would do that also. If you do not have this capability at all, when you go to hit this checkbox, you're going to get a stop sign right there, and it's not going to allow you to do it. I'm going to show you just in case you are in a position that needs to know that. I will also warn you that every time you override patient consent, it's going to go on an audit log report under your username. It is associated with your username. It goes on an audit log report. All of the facilities can have Big Sky pull that and send that to them, and they can see your username has done an override on this patient, and this patient. So it's all going to be logged. So keep that in mind. When you do override patient consent, you do get a couple of fields here that are required. You do have to put in a reason. And for me, it's always that I'm training here. Again, the authorization type does default to emergency. That is the only authorization type that SCL is allowing for their emergency staff to use. Authorized by patient, if it's not authorized by the patient, let's say that David is in my emergency room and he's unconscious because of an accident, I need to know if he has any allergies or is on any specific medication that may affect his treatment. So as the clinician, I'm going to override him so I can actually uncheck that and put in the information of the person that does override that. So I'm going to say spouse here as being the overriding party there. Again, if you don't have this functionality, you're going to get a stop sign and you'll never even see this part here. So what I'm going to do is clear all this out because I don't want that to go under my username yet again for that audit log report. And I'm going to go ahead and search for David. Again, I am using a test patient. So I am on a separate account from what you would see in production. With the information that I put in there, I would probably get 4 or 5 search results from the information that I put there. And as you can see, they would be listed right here, very easy to see. And that's where this weighted match column comes into play. The one that matches the best, the one that has the most information that matches what I put in that demographic section will be listed here at the top, and then it will filter down from there. So most likely the patient that I'm searching for is going to be either at the top or near the top. So it's going to be pretty easy to see. Again, my test patient, pretend information here, but I can, let's say that I'm still not sure this is the David that I want. I can actually look under his identifiers here and see what facilities he's associated with, medical record numbers. If he has any aliases, those would be listed here. Any address changes would be listed here. And he can have more than one identifier under here. There can be multiple identifiers under here. David just has one. But again, this is a facility that he is associated with. This is the medical record number associated with him at that facility. I could use that to search for him next time using that search by medical record number section if I wanted to. I'm going to show you an easier way in a little bit to get to David's record, but that's where you can find that information if you needed it. Coders, billers, front office staff, if you need it for records, that's where it is there. Now you can see that these are those clinical icons that I talked about earlier being on that quick guide. The quick guide does have a picture and a description of every single icon that you can possibly see in the HIE, but it's really easy after you've been in here a couple of times, you'll pick it up because all you have to do is scroll over them and it's going to tell you that this is the information that this source has contributed to David's record. And again, there could be multiple ones here, and most real patients do have multiple sources of the information. But I can see that David has allergies, he has a lab order, encounters, patient demographics, he has a diagnosis, radiology order, and medication in his record. I can use all this information to determine that, yes, this is the David that I want, so I can access his record. I can click anywhere on either one of these lines to get to his record. Any questions so far? Sorry, I'm teaching from home today because we had some transportation issues, so sorry about the background noise. Okay, no questions? Okay, we'll keep on moving then. When you enter a patient's record, what you come to is the clinical summary. The clinical summary is designed to give you that quick glance into the patient's record. If this is all that you need, then great, you got the information, you can get out of it and you can get back to patient care, which is really what the system is designed to do, to help get you the information quickly so that you could get back to patient care, because that's really what we want as healthcare professionals, is to spend more time with our patients and less time in the system. So it gives you, it gives you 6 sections that we felt were most important for the information that you may need. And you can see those are diagnoses, lab results, allergies, diagnostic studies, medications, and documents. Now, we do not have clinical documents coming into the system yet. That's why this is blank here. When those start coming in, you'll see them start to populate here in patients' records when they get them there. In each section, there are the 5 most recent results. Obviously, if there's only 4 or 2, that's all that's going to list there. But if you were to get a few more here, then it's going to push those down because the 5 most recent will be in the list. Now I can see that under diagnoses here that it does have more, and I can scroll through those 5 at a time if I wanted to. But at this point, if I was interested in the holistic picture of David's diagnoses, I would go to the condition tab to see the full list because it's just easier to view it all that way than scrolling through them 5 at a time. But if it was the most recent diagnosis that I was interested in here, I can get to all the details that I need to from this screen, which is really what this clinical summary is designed to do. Before we go into that, I'm going to talk about the banner up here. Now, this banner does stay on the screen no matter where I go to in David's record. This is going to stay up here. It has his name, his birth date. If there's a date of death, that would be listed right here. His age, gender. I could have some text here. If I was viewing sensitive data, it would let me know that, hey, you have overridden the sensitive data and you need to protect that and have some legalese there to remind me. If there was a large data dump for this patient since the last time he was accessed, I may have some text here saying, still loading record, please wait. And then that would change to refresh when it's done. And that only usually ever takes a couple of seconds, and then just hit the refresh button and it's good to go. There could be some alert icons. These are designed because, first of all, I'm viewing this on a large monitor, which is why you can see the full screen here. But if I was viewing this on my laptop or on a tablet, then it would actually make all of this one column, be a little bit harder for me to see what's going on as a full picture here. So I may be interested in the fact that, hey, this patient has allergies, so I need to find that information if that was what I was interested in. And the alert icons are pretty easy because you can just select it and select that, and it takes you to the allergy screen so you can see that information. I do have this back to button here. If you just select the button, it takes you back to the screen that you just left. It does have some breadcrumbs though, so if you want to go back further, you can do that, but I always use it to just go back to the page that I just left there. This one is telling me that he has some patient demographics that's been updated recently, so I may want to check that out. Now, again, if you do not have the sensitive data override capability, and again, I think that's just going to be with the emergency department, you won't even see this button here. So you would never even know that David had sensitive data in his record because you're not going to see the button and something that's displayed unless you can override it there. This ellipses here, again, is in this banner, so it stays on any screen that you go to with this patient here. And what this will do, if you select it, then it gives you this fly out of this high-level demographics. Again, I can ensure that I'm on the correct patients. But this also gives me access to the patient summary. And the patient summary is really where you can get all of the information in one place on the patient instead of having to go through the different screens and stuff. So I'm going to go ahead and access the patient summary here. Now, you will not see the send button because SCL is not doing direct secure messaging through Big Sky Care Connect. You guys are using your provider that you already had for that. So you won't see that there. I think SCL is not allowing their participants to download the summary also. So you shouldn't see this button there either. This is if you needed to maybe download this to send, to attach to a third-party direct secure messaging email and send it for a referral or something like that. But I think SCL has decided not to use that. But you can still view this report. And again, it is the best way to see all of the information on the patient in one place. It does default to the HTML format, which you can see right here. And that's just that computer language for being able to view it easy on the computer screen, which as you can see, it's pretty easy to view there. And this is the basic report that it defaults to. The basic report has the patient demographics, allergies, medications, encounters, diagnoses, and laboratory results in it. And, you know, that can get pretty long there, but that's the basic report. There's also an expanded report. Now, when all of this information is coming into the HIE, this will be a pretty nice report. But right now, since some of this information, most of this information is not coming in, it's going to say none under those categories. But when it is coming in, it's going to be cool. So you're going to get alerts, advanced directives, program memberships, patient-clinician relationships, upcoming appointments, anything and everything as far as the patient is concerned, immunizations when those start coming in, radiology, observations, procedures, physical exams, problems. So we're really excited that eventually all that's going to be coming in, and this will be a really cool report to have. But I'm going to go back to the basic report because we do have all those sections here, and that's fun to look at here. Now you can view this in different ways. Again, it does default to the HTML view there. You can view it as a CCD, and this is just that computer language to talk between systems. This is an IT thing that I don't deal with here, but I just want to show you what that looks like there. And you can view it as a PDF. So we have to talk about the PDF because PDFs have some options that are inherent to PDFs, such as this download button and this print button. I have to advise you not to use either one of those buttons. Please follow your organization's policies over when it is okay to download or print protected health information, because I'm pretty sure SCL is not allowing either one of those things to happen. But you're going to have the option here because it's inherent with PDFs, which is why I recommend if you're going to view this, if you can't download it or anything, just go ahead and view it in HTML because it is just easier to view that way on the computer screen there. Okay. I will point out that laboratory results on the screen, on the clinical summary, on the tab, and on the patient summary here, you will see that anything that is abnormal is going to be listed in red. So it draws your attention to it so you can make sure that you check those out. And I'll show you when we get to the screen on that also. Okay. Any questions over the patient summary? Okay. We'll go back to the clinical summary here. And now let's talk about these diagnoses here. Changes are updated in real time, Courtney, except for with medication. Medication, that's going to change in the future, but right now our only source for medication is Dr. First, and Dr. First updates the medication list for all patients in the HIE every 4 hours. So there could be a time that maybe a medication hasn't made it to that list, but all other updates are real time. When they are made from that organization that is contributing that data, it updates real time on here. Now, you may see some language up here that says new information has been added. Please refresh the screen. That's if there's a large amount of information that's been dumped into that patient's record while you're in it. And then again, just push that refresh button, or you could go up here and do your browser's refresh button, but they are made in real time. That's a great question. Thank you. So for the diagnoses here, let's say that I was just interested in this most recent diagnosis. I can go to the details over here, hit that column, and it's going, again, this is a pretend information here. All this is filled out in production. It's going to take me to the information here and get what I need, get out of this record, get back to patient care there. Go back. If I was interested in the holistic picture of the diagnoses, I would go over here to the condition tab. Select it. It's going to give me the full list of the diagnoses here. So that's going to be easier for me to view than having to scroll through it 5 at a time there. Back over here to our clinical summary. Lab results, again, if there is an abnormal result that is associated with that lab order, there is going to be a red bar right here to draw your attention to it. David only has 4, so I can actually see this pretty good from here and be able to get to the results and the details from here. There's a lot of information around lab results, so I recommend that you do get in there and check out all the different options that you have there. So if you hit the details, you're taken to this screen. This is the result details of this lab order. Again, if you scroll through, you're going to get a red bar for anything abnormal. It's going to be in red so that it draws your attention to it. Now, if I was interested in just one of these test items, I can actually click it, and it's going to take me to the test item details. You can do that for anything that is in blue. That means that it's linked somewhere else, so I can view more information on that. So I can go through and do that. If there's any comments, those are going to be listed down here at the bottom for that. I can also get to the order details from here. Select the order details screen. It's going to take me to the order details for that lab order. I can get that information that I need. If I hit the back to button, I go back to those results there. I can also see the cumulative view. Now, this doesn't help with David because he doesn't have any cumulative views, but if he had had the same type of test recently, then it would list the two tests together so I can compare the values there. Again, here, these are linked, so I could go to the actual test item details from here if I needed to. Anything abnormal is going to be in red. And again, it's good to do kind of a comparison there. Now, if I did have two results, then it might be nice to graph them to see how they compare to each other. Again, this isn't as nice because he doesn't have two results to compare, but if I wanted to, I could just graph this one result here. So it does give me this graph here. I can pick the values that I want on the graph. I'm just going to go down here and make sure that I hit refresh graph, and it's going to plot those for me. Again, if there were multiple tests on here, it would give me the comparative values of those topics on there. Takes me back to the cumulative view there, and this takes me back to the results. So I can get to everything that I need to from the clinical summary on those. So the results screen here again will take me here to see the results of that test. And most of the time, patients do have more than 5 lab results in their list. So it's usually easier to see all of those together on the lab results tab, which we will talk about in just a few minutes. Allergies, we've already been to the allergy tab because we did that from the alert icon up there. And he only has 2, so it's really easy to see that information from here, what he's allergic to. Diagnostic studies, again, he only has 2, so I can get all the information that I need to from here. If I was interested in this Rust echocardiogram, I could hit the details. It's going to take me to the details screen here. Now the results are going to be listed here, and I go through them. Comments will be here at the bottom. Administrative details up here. If I wanted to get to the order details, I could do that from here. Here are the order details for that Rust echocardiogram. I can go back. I give you the bone density study from here also, but I'll do that on the tab just so I can show you. Again, documents are coming. I know that they are in testing, so they should start anytime now. And I know that we have a couple of organizations that are ready to start contributing that data. So pretty soon you're going to see discharge notes. You're going to see any type of pictures or diagnostic pictures here. Patient pictures can be here. Any type of documents that would come through will be listed here, and you can actually access them from this screen. If there's more than 5, though, which most likely there's going to be, then you'd go up here to the tab to view them all if you needed to. Medication, usually patients have a pretty healthy medication list. So I would recommend, if you are interested in the holistic picture of medications, please go to the tab to view all of the medications, at least mostly in one place there, because you can see more on the screen at a time there. But if it was just this most recent medication that David was on that I'm interested in, I can get to the details from here. It's going to take me to the medication detail screen. I can see the name of the medication, the dose, the form up here. Again, as a patient, most of this information is filled out in production. What's interesting about what I like about these down here in this order notes section, these text instructions, this is what was actually written on the script for the patient. So you can go back to David and say, hey, I just want to confirm that you are taking this the way it was prescribed. And then, of course, the order details here at the bottom of the screen for that. Okay, any questions over the clinical summary? Okay, we talked a little bit about this conditions tab here, but let me show you that all of these tabs, they act in the same way. All of the lists default most recent to the oldest result. So all the lists are going to be where that most, sorry, give me just a second, sorry about that. Sorry, hazard from working from home today. Okay, and it's not really a Zoom meeting, right? Unless we have a dog bark at some point. Again, all these tabs act in the same way. If they have a blue bar here, then what that means is that there's information on that tab. So any tab that does not have a blue bar, I do not have to waste my time by looking at that tab because there's no information there. So I'm not going to have to look at those. But again, defaults in the list, most recent to the oldest result. You can also search each of these lists. Looks like I lost Vicki and Stacy there. I am recording, so hopefully they'll get back on, and if not, then I'll just send them the recording. So it's just me and you, Courtney, now. But all of these sections do allow you to search. So if I just wanted to see a keyword here, I could put it in, hit enter. It's going to give me just that keyword in the list here. If I wanted to get back to the full list, just delete that out and hit enter again, and it takes you back to the full list there. And each of these lists have different sort options. If I wanted the diagnoses in alphabetical order, I could do that. Or I could put them back on the date last updated, most recent to oldest. So again, it does default most recent to oldest, but you can change those if you need to. Again, we got to all of the details that we needed to from the clinical summary for the diagnoses. If David had any problems, those would be listed down here. So it'd be the problem name, the onset date, the end date, which is what signifies it to move down to the historical problems column or list down here, provider, facility, status, and the date that it was uploaded or reported. So that's the conditions. Allergies, again, we viewed all the allergies from the clinical summary there, but what I like about it is that if he had more than 5, or if I needed a better picture of the allergies that he did have, this one actually sorts by category. So I could actually select the category column here. And what that would do is lump all of the drug allergies together, all the food allergies together, all the environmental allergies together, all the animal allergies together, and give me a better picture of his allergies within those sections. Vicki and Stacy, you guys okay?
We're good, thank you. We just lost connection.
Okay, I figured that's what happened, but again, we are recording, so if you needed to go back and watch that, I was just talking about the diagnosis screen, and now we're on the allergy screen, so you didn't really miss much. Medications, again, it's usually easiest to view medications on the medication tab because patients usually have a pretty healthy medication list. Again, our only source right now for medication information is Dr. First. And Dr. First does have access to most of the major pharmaceutical databases, SureScripts being one of them. And they do update their information every 4 hours on everyone in the system. Now, eventually, we are going to have other sources of medication data from organizations, from providers, from local pharmacies in Montana. Those connections just haven't been made yet. And this was an easy first connection to make to get that information coming in quickly. So it was one that we prioritized to make. So eventually, the source you will see be different people, but right now it's just going to be Dr. First as far as that source goes. Now, if David had any medications that were under 90 days, the state was under 90 days, then it would be listed up here in the current medication list. Over 90 days, it gets moved down here to the historical medication list. Now with medication, I do recommend that you do a secondary sort if you are interested in the holistic picture of his medication use. And what this does for you is I can select the medication column on either one of these, and it's going to lump all the like medications together for me. Now it defaults most recent to oldest, but if you've messed with the formatting or the sorting here, then go over here to the sort options, go to secondary sort here, date, most recent to oldest, and just select that. And what that's going to do is it's going to keep all the medications lumped together, but now they're sorted the most recent to the oldest within those medications. So I can easily look here and tell that David had the sertraline pretty regularly between this period here. So it gives me kind of that better picture into his medication use there. Again, if you want it to get to the details of the medication, you could do that on the clinical summary, or you can do it here by hitting the details column. Again, medication name, dose, form, duration up here at the top, just to give you that quick level view there. Here's the fill date, the start date with the source. Again, this is what's really written on the script, so you can tell that, and then the administrative details down here. Documents, immunizations, vital signs, those are coming. lab results. We did see that on the clinical summary, but here, up here at the top, it's going to list the lab results by date. So I can check them by date. All I have to do is click each of these here. We looked at that other one. Let's look at this one. Again, any of the abnormal results will be in red to draw my attention to it. I can get to the order details in the cumulative view if I needed to. I could do a cumulative view straight from the list here if I wanted to. Again, if he had multiple ones, it's just a test patient, but I recommend that you check that out on your actual patients because it's really cool view there. And I can get to any of the line item details there for any of those line items by selecting the name of the lab test there. You get to the order over here also if you needed to. Yeah, so lots of good information in lab results there. Diagnostic studies, again, we got to all the information that we needed to off the clinical summary. Let's see, we looked at the rest echocardiogram. We can look at the bone density study here. Again, here's the information. Here's the results. I can scroll through, comments at the bottom. I can get to the order details right here if I needed to. Procedures. Now, you can't find procedures on the clinical summary. So this is really the only place that you can get to the procedures. And this is going to give me the procedure name, procedure date, the provider, and the facility of the procedures that David has had completed here. So this is really the only place I get that information, or off of the patient summary if you've accessed that. Histories are coming. This is going to give you social determinants of health and other family histories for that patient. Encounters, this is where you can come, again, not on the clinical summary, but this is where you can come to see any outpatient, inpatient, or emergency encounters. We are also trying to get observations as one of the encounter types. That hasn't started yet, but hopefully it will start soon. It's another one of those things that we've been pushing for, and I think it will actually start pretty soon. But you can see that David has emergency, outpatient, and inpatient encounters here. And again, it does default most recent to the oldest in all of these lists, and you can search for a specific one if you wanted to, or sort in different ways here. If I wanted to maybe lump all the inpatient, outpatient, and emergency encounters together, I could select type there and look at put them all together for me. So I can view them that way if I wanted to. I can sort by date if I wanted to. So that's the oldest to the newest, or the newest to the oldest there. But it's going to give you the type, the start date, the end date, the provider name, if that's in here, the facility. If that encounter resulted in a diagnosis, then that would be listed here. Discharge disposition is listed here. The local medical record number for that encounter for this patient will be listed here. And that could be different per encounter, per facility, per patient, obviously, here. But again, this is just a test patient. You can also see the individual insurance per encounter. So let's say that it was this most recent encounter that I was interested in. What insurance did David use? Now, David doesn't have any insurance, but I can show you what it would look like if he did. It would list the payer code, the payer name, the plan, the card number, when is it good to, and the card holder name here. Now, I know that he used self-pay on one of these. Let me see if I can find that one to show you what that looks like. There you go. Self-pay would look like this here. Now, if you needed to know the most recent insurance that David has used, and it's not under that most recent encounter there, instead of wasting your time going through each individual encounter to find that information, get it on the demographic tab, which we are going to next, because it is the easiest place to find all the insurance that he's used in the past, starting with the most recent at the top there. So that's where we will go to next, our patient demographics. And it is broken down into different sections here. We have the patient details, address details, the primary care physician, if that is here in the record for David, clinical details, additional demographics. If there was a date of death right there, then this is where that information would be listed. I can see that these are in blue, so that means that it links somewhere else. This is every active medical record number on David in the system, so I can select that and be taken to there. And I can use this information next time to search for David in that search by medical record number section if I wanted to. Go back. Patient contacts, if David had any, that could be listed here. So first name, last name, relationship, contact type, and then the contact information here for that contact. Go back. This right here is just for audit log purposes. So when was the date and time that this patient was last updated, what hospital, facility, organization did the updating, and what was the name of the user that did the updating. Again, that goes on an audit log report there. This is where you can find all of the insurance that David has used. So instead of going through each individual encounter, unless you needed it that way, this would be where you can find that holistic picture of the insurance for David with the most recent at the top. Again, this is a pretend patient, but it would have the date here. So if I was interested in that most recent encounter for the insurance, I could see what encounter he used that on with the date here, and then go back to the encounter screen and compare it there if I needed to. And support contacts, again, if he had any, those would be listed down here. Again, I can search each of those lists or sort them by date or by name, depending on what I wanted to see with those lists. Okay. Any questions over anything as far as the patient information goes?
This is Stacy. I was just what was I going to ask? Talked about the last time it was edited, like it puts the person's name there and what facility it was done at. So if we saw a patient in our clinic and then sent them out, would that automatically update or?
No, only if you actually input information into the record.
Okay.
So if it was just a view only, if you were just accessing it to view the information on David, then it wouldn't update that section for you.
Okay. So how does the information get into Big Sky Care Connect? Is it, if the patient agrees, like let's say I'm a patient, I agree to let everybody see my information, does that automatically populate if I end up in Missoula in the ER? Or...
So they would have, their technicians would input that information, and they go through a training on how to do that. And usually it's with their electronic health record or electronic medical record system that they have. Those are connected to the HIE. So whenever the information is updated in their electronic health record, it automatically updates it in the HIE. And then it would update this right here also, that, that this user at Missoula had put in this information at this time for this patient. Does that make sense?
Okay. Yeah.
Right. But if you're just viewing the record for the patient to get information that you need, then it won't update this. You're just viewing it. Good questions. Anything else? Okay. Just a couple of other things to talk about, I promise. If you need to get back to the search and viewer for any reason, just go ahead and select that magnifying glass there, and it will take you back to the search and viewer, and you can search for a new patient if you need to. You also have this My List here. Now, what this My List does for you is it gives you total control over the patients that you want to put in this list, because it is associated with your username. So what Vicky has on her My List, I do not have on mine, and I can't see hers unless I'm logged in under her, which I shouldn't be. So this, you have total control over. Use it in whatever way is most effective for you. I do have some users that they like to, in their EHRs, they like to open up separate tabs for all the patients that they're going to see that day. That doesn't work in the HIE. Our HIE has a timeout of 15 minutes, which means that if you don't touch one of those tabs for 15 minutes, it kicks you out of the whole entire system. So it's really a waste of time to do that in the HIE, but you can do that here in the My List. You can go ahead and add the patients here, and then when your patient comes in, you can just click their name from here and go right to their record. So it's a good alternative for opening up separate tabs that you can't do here in the HIE. Or you can use it as maybe your cohort list for now until those cohorts start. So patients that I see most often, or patients that I need to keep a special eye on because they have this condition or they're on this medication or some other reason. So any way that it's most helpful to you. And what I usually do is I usually keep my training patients on here, so it's easier for me to access them when I need to. And it's very easy to add patients to the list. We're going to go over here to add a patient. It's going to take me back to the search and viewer, but it says My List up here, so I know that I'm not going to be accessing a patient record here. I still have to meet the minimum criteria for a search, so I'm going to put in David's first and last name here, hit search. It's going to pull up my patient here. I'm still on My List, so I know whatever I select here, it's not going to open the record. It's going to put it on the My List for me. I'm going to do that here. And as you can see, David is now on my list. Now, what that does for me is that when I log into the HIE here, this is my search and viewer screen. I can go to my list and I can search, or I can get David right from here instead of having to go through that whole search and viewer step there. And there's his record. So again, use it however it's easiest for you. When you are done with that patient, all you have to do is go back to the My List, go over here to that ellipses, and hit delete patient from the list. And he will delete off of there. You can add as many patients as you want to here. So again, use it however it's easiest for you. Now you will see that there is this override consent policy checkbox up here. Again, SCL doesn't want their users using this, and that's fine. You'll get a stop sign if you're not allowed to use it. But it's here because if you add a patient here, and let's say that sometime between me adding David and me seeing David and needing to access him, that he opted out of participation from the HIE, well then when I go to access him, I'm going to get a note that says, hey, this patient has been filtered due to consent. So that lets me know, hey, he's opted out. And if I'm in that user role where I can override that, then I can actually do that from the My List here. So that's why it's there. But again, this is a really helpful list for whatever you need to use it for. So make sure that you utilize it because it's really underutilized and it's very helpful. This envelope here, you won't have access to this. This is if you have direct secure messaging through Big Sky Care Connect, this is where you can check your messages and stuff. Under your username here, you will see this profile button. Maybe if I get mine to work here. Okay, well, mine's not going to work. Let's talk about the about here for a second. About this is just the system information, so nothing really anybody wants to know about. The settings and help, these are not activated yet. Help will eventually, if you select that, then you'll be taken to the help desk or be able to contact the help desk from here. So that should be activated soon. I've asked the vendor about the settings button and they don't know what's going to go under there, so they may delete this altogether. But if they decide to utilize it and they have something specific there, then I will release a training video on that. And then of course you have the log out button here. Again, the system does have a timeout of 15 minutes. If you don't touch anything in here for 15 minutes, it's going to automatically log you out. No warning, it just logs you out. It's very aggravating. And you have to get back to wherever you were if you weren't done doing that. Now, I need to show you the profile because that's where you put in your account information. So let me go to my testing account here so that I can show you that. Sorry about that. I just checked it before I got on here too. Sorry, kids are getting home from school and the dogs are getting all anxious. Let's see here. Let me go to Dave. Oh, let me just go up here. There we go. Now I have the profile button in my testing account here. And what I want to show you here is because I know SCL has asked all of their users to make sure that they put in a challenge question and challenge answer in their account. And we'll talk about that in just a second. All you are required on our side to have in here is your first and last name, and the help desk will put that in there for you. Obviously, if you see that there's a mistake or if your last name changes and you need to change it here, you can do that. Just make sure that you hit save account so it will update that in your account. You can add your mobile number if you want to. This is where you can come and change your password. So you will get an email every 90 days saying, hey, your password is about to expire. Please get into the HIE and change it. This is where you would come to do that. But you don't have to. If your password expires, when you go to log in the next time, it's going to automatically prompt you to change it. So you don't really have to come in here and do that because it will make you do it on the login screen after it's expired. So whichever way is easiest for you to do that. If you are the type of person that likes to update your password more regularly than 90 days, then this is where you can do it on your own here. And then this challenge question and challenge answer. Not required, but highly recommended, because if you have a challenge question and challenge answer in your account, then you can reset your password on your own when you have forgotten it. If you don't have this in your account, then you have to go through the help desk to do that. So I strongly recommend that you put this in there. And again, it doesn't have to be anything big. It can just be words. You don't even have to have a question mark there if you don't want to. I just like to try to make it a question. But first card, question mark, and this is the answer to that. Again, anytime you make any changes here, just make sure you hit save account so that it will update in your account. Okay. And other than that, that's all that I needed to show you in here. Anything that you want me to review before I leave and get back to the PowerPoint?
Thank you.
Oh, no problem, no problem. Let me go over this really quick with you here. Welcome email. If you haven't gotten it, check your spam folder. If you still don't have it, then contact the help desk because there might be a firewall issue, but I think everybody at SCL so far has gotten theirs. If you've put in the AUA form for that. If you forget your username, we usually don't encourage the changing of usernames unless there's a special circumstance. And again, you could get 2 usernames if you asked for the test patient in production. I need to slow down just a little bit. And when I say contact the help desk, you do not necessarily have to call them. You can send an email. If you don't have time to be on the phone with them, send a quick email. Hey, I forgot my username. Could you please send that to me? And then go and do whatever you need to. And you should have that email waiting for you when you get back to the system or when you get back to needing to get into the system there. So if you forgot your username, contact the help desk or look for that original welcome email that has your username in it. If you need your username changed, we usually will change it, like if there's a security risk or something like that that's happened. Of course, let us know and we will change it for that. If you try to access your account and fail 3 times, so you've put in your username or your password wrong 3 times in a row, your account will become locked and you have to contact the help desk in order to get it unlocked. This is where that challenge question and challenge answer comes into play for your account. If you have that in your account and you put in your password wrong the first time, you're going to get login failed and you're going to get access to this forgot password button. If you don't have a challenge question and challenge answer in your account, you will never see this button and you have to contact the help desk if you forget your password. Usually takes me a couple of times to remember my password, so I may try it again. I'm not going to try it the 3rd time because if I'm wrong the 3rd time, it's going to lock me out and then this forgot password button doesn't matter to me anymore. So I might try the 2nd time. If I still have it wrong, I'm going to select the forgot password button. It's going to pop up this new box. I'm going to put in my username. It's going to display my challenge question and I'm going to put in my challenge answer. That challenge answer is not case sensitive. So if you have all uppercase in your account and you put all lowercase in here, it doesn't matter. It's just based off the characters. Then I'm going to hit request email. That's going to send me an email to my contact email that has a temporary password in it. I'm going to log in with that temporary password. It's going to prompt me to change it to my new password. A lot of steps, but still a little bit easier than having to get on the phone with the help desk and have them reset it for you there. And this is just saying if you don't have that option, then you have to contact the help desk to reset your password. This is just a reminder that if your contact email, that's that email that you got your welcome email to, that you would get, hey, your password's about to expire, email to, where you would get that temporary password to come if you were resetting your password. If that happens to change, just send a quick email to the help desk and say, hey, would you update my contact email to this because it has changed? And they will take care of that for you. And then that way, if you do have to reset your password on your own or something like that, then that password will come to the correct email for you. And that is what I have. You have learned how to get started with the HIE, how to use the search and viewer, overriding patient consent, and when that is okay, and make sure again that you're using your organization's policies around that. Clinical summary, how to view the patient summary, the functions available on the menu in your user profile, and that troubleshooting that we just went over. This is that contact information again that I said that I would show you. It is also in the user manual. It's also on our website. Again, if it's easier for you to just email me, then do whatever is easiest for you to either get your question answered or talk through something or request something altogether. We want it to be as easy for you as it can be. So please let us know if there's anything that you need at all. We are all here to help you. And do want to let you know that we appreciate everything that you do. I know for this past year and a half, it's been very difficult on healthcare workers, and I want to let you know that we appreciate you. Are there any final questions for me? Thank you, Courtney. I appreciate that. And it will be a really great resource for healthcare workers. Again, it's made a world of difference everywhere that I've trained on these types of systems and stuff. There are plenty of stories that come out of use it and patients who have been on the other side. And if you have one of those stories in the future, please let us know. We're always excited to hear that type of thing. I will be following up with you guys in the morning with a follow-up email. It's going to have a link to this recording. I'm going to give you the answer to how long those announcements stay on the login page there. And it's going to have a link to our training evaluation survey. That just takes a couple of minutes to complete. If you don't mind completing that for me, if you get time, if you don't, it's not a big deal. It's just a resource that we use to make sure that we are training people in the way that they need to be trained. And I want to thank you again. I hope you guys have an awesome afternoon, and please let me know if you need anything at all. Thank you.